that kind of number makes a little more sense. That to me is like it's like emergency services that you get from fire and police, and it's and there is a law out there that even hospitals do have to treat people who come in with emergency injuries. So it would just be another extension of that. The thing I worry about is that it's like income tax. When income tax was first passed, it was only 1% on the average citizen and 7% on the rich. And of course, it's now expanded to about 20% to the average person and 40% to the rich. So there would be creep, once you pass or expand the program to cover more people. They could play with the numbers later. That's something I would worry about. What do you think about? Is there any other kind of like a way to kind of limit the taxpayer or kind of open-ended liability and the race to the bottom in quality? If as far as this public option, is there another way to do it? I mean, that was just kind of my simple first idea for limiting it.
Well, the hospitals are mostly privately owned now, as it is, so you're not going to eliminate the profit motive right away, and the government is still going to have to work with all the private companies, so they're not going to be able to remove them from the equation.
Yeah, essentially, if they have a single payer option, now that's almost an oxymoron in itself. Single payer really means there is that's different than public option is a government insurance program. Single payer, I thought, really meant get rid of the private insurers. Is that, or maybe I'm misunderstanding the term?
No, it does theoretically mean that. It's just that's not what's going to happen.
Yeah, I think they're not going to get that. Actually, if you've seen some of the poll numbers for Obama and his program and his and the public perception of these bills, it's gone down a good 10 points in the last 2-3 weeks to where a little under 50%. So it's basically got only minority support now, the way they're written. So, and now that the Senate is not going to be able to get a bill out, there's going to be a lot of pot shots taken at the bill they have and at the whatever the House comes out with for the next month. That's why they wanted to get it done so badly. They didn't want to have it shot at for a month, before they can get back into session. So
but whatever they turn out is not going to be their best work, and it's not going to work flawlessly. For God's sakes, it's just the starting ramp.
Yeah, whatever the House comes out with. Well, first of all, no one's going to have time to read it because they're going to cobble it together at the last minute like they've been doing all these bills. So I'm sure whatever they come up with will be shot at really viciously throughout the month, and as will the Senate version. So there's going to be a lot of damage control they're going to need to do. Now, I want to introduce something that Paul Krugman wrote in the New York Times. He's actually my favorite statist columnist to hate because he writes all kinds of stuff. He's an economist by training. He won a Nobel Prize, which puts now with that now that Al Gore's won one now I think there's no credibility left in the Nobel Prize whatsoever. But
Joey,
maybe I'm a little harsh there, but. The title of the column is Healthcare Realities, and he claims in the column that the reason the present system works so well as it does now, or works as well as it does now, is the government protecting the insurance consumer through the the employer-based health care plans being actually the regulation protects the employee from being denied insurance based on pre-existing conditions. And I guess that's true. I've changed jobs 4 times in the last 20 years, and I don't remember ever having to fill out, something like when you fill out your medical chart when you go to a new doctor. I never had to fill that out going to a new company. So they just automatically put me on. I check the box and say, yeah, I want whatever plan, and they put me on it automatically. So, there is truth in what he's saying there. But here's my problem with that rationale, is that because it's a third party situation. He's actually if you call the employer the third party, getting in between you and the doctor, and the way the plans are written, they're pretty open-ended, and in the sense of cost control, there really isn't any. The doctor really wants to do as many tests as possible in order to cover malpractice liability, and then because there's no money's not coming out of your pocket any more than like your copay as a consumer, the employee just after they pay their copay, pretty much you just have. It's not completely true. I think my top out of pocket is like $3,000 for a year. So if I had a lot of extensive care needed, it's still pretty low. So there really isn't cost control in the present system. But I wouldn't say the system works so well because the government forces the insurance companies to not look at your history. I think the system works well because insurance is basically a good business model. It's a risk pool. They make a lot of money and they pay out a lot of claims, but I guess they take in more money than they put out. The problem is it's not really they can't really look into each case, so they just operate statistically.
Well, they can look into each case. This is one place where the government program is ahead of the curve. As far as genetic testing goes, they don't do a lot of it right now, but they will be, and pretty soon there will be. Everybody will have pre-existing conditions based on their genetics.
Yeah, that's why I think under current law you can protect your genetic information, but I might not be right on that. Once somebody does a DNA panel on you, I don't know if you can control that, where that goes. I wonder if a doctor can sell it to another doctor or put it on a website or something. I don't know.
Well, the insurance companies and the hospitals all share information as it is, so like they'll find out if you've been hospitalized prior to your joining up with a new health plan.
Now, Krugman says, and you might agree with this, is that, but I think it's a distortion. Let me see what he says. The thing you need to know about healthcare is that it depends crucially on insurance. You don't know whether you need treatment, but if you do, treatment can be expensive. We know that. Yet, private markets for health insurance, left to their own devices, work very badly. Insurers deny as many claims as possible, and they also try to avoid covering people who are likely to need care. Okay, I disagree, because if they were to deny as many claims as possible, that would make them less competitive with other insurance companies.
But all the insurance companies are doing this.
Now, wouldn't they have to collaborate and share data on what procedures are denied in order to be able to deny as many claims as possible? If they were in the business of doing that, if they tried to do that, I could see how that would work if they colluded. But if they don't collude, then